Hi, this is Dr. Lisa Groves with a cognitive behavioral therapy practice, 415-250-2290. This is the second video in my behavioral series. Now we will look at obsessive-compulsive disorder. It is an aspect of anxiety, and it's indicated when you're dealing with persistent thoughts that you feel you have no control over, and a compulsion to engage in a behavior that neutralizes those thoughts. One way to recognize that this might be going on for you is that you engage in a behavior until it feels right. And that might be checking to make sure the stove is off. It might be counting. It might be washing so much that your skin bleeds because it just has not felt right. You have not felt clean. The behavioral aspect of treatment of OCD, which is done at your pace, is exposure response prevention. And what we look at is very specifically what your thoughts are, and we look at upping the ante in exposure and then preventing you from responding, thus sending evidence that the world is not falling apart, that you remain safe. For example, say your phobia is, or your obsession is around cleanliness and not feeling clean. We put you in situations where you're touching a doorknob and then you are not allowed to wash your hands. We take time before we take you to that stage, but the exercise is intended for you to see that you might engage in a behavior that seems unclean, not wash, and you remain safe. Another aspect of OCD can be thought-action fusion, where you have a thought of something horrible happening and you believe that it's linked to that horrible event happening. And what we do is we slowly break that link between you having a negative thought and believing that something negative is going to happen, which causes a lot of wear and tear on you, both cognitively and in terms of energy. Thank you.